Come in.
Hi, I'm Emily. I'm going to be your nurse today. How are you?
Good. How are you?
Good. Can you please state your name and date of birth for me?
Bailey, January 17th, 1997.
And are you in any pain today?
No.
And are you wearing any assistive devices?
No.
And now I'm just going to wash my hands before we get started. So I'm practicing good infection control. I'm not wearing any jewelry. My nails aren't painted. I sanitized my stethoscope prior. And patient seems comfortable in her chair. There are no obstacles around the room. So now I'm just going to do a quick head-to-toe assessment today.
Okay.
So you seem alert. Now, can you tell me where you are?
At the doctor's office.
Can you tell me what the date is?
November 30th.
And can you tell me who the president is?
Donald Trump.
Patient is alert and oriented ×3. Now I'm going to say 3 words to you to repeat back to me, and then I want you to tell me what they are later in the assessment.
Okay.
And the words are mirror, ball, shoe.
Mirror, ball, shoe.
And patient's speech seems clear and articulate. There's no slurring. Now can you stand up for me so I can assess your gait? Can you walk to the back of the room? Gait is fluid. There's no swaying. Her posture is erect. Can you close your eyes so I can assess your balance? There's no swaying. So you can open your eyes. And now I'm going to test your fine and gross motor function. So can you put your heel to your shin? And on the other side. And can you tap your knees back and forth and your thumbs to each fingertip? So coordination is good. Fine and gross motor function is intact. You can sit down. Now can I assess your pupils?
Yeah.
Pupils are round and equal. Now I'm going to test your peripheral vision. So just tell me when you can see my fingers.
No.
That's about in line with the ears, which is normal. Now I want you to follow my pen light. Six fields of vision are good. So now I'm going to look at the pupils. They're round, they're equal. Reactive to light. And now can you follow my pen? They accommodate. Now I'm going to look at the size. Patient's pupils are at about a 5, which is normal. Okay. So now can you smile for me? Frown. Puff your cheeks. Raise your eyebrows. Cranial nerve 7 is intact. Now I'm going to place my pen on a part of your body, and you can, with your eyes closed, and I want you to tell me where it is.
Left leg. Right arm. Left side of the neck.
So sensation and point localization is intact. Now can you tell me what those 3 words were before?
Mirror, ball, shoe.
Good. So now I'm going to move on to your hair, skin, and nails. So anytime I'm palpating, I'll usually have gloves on, but I don't have any with me right now. I'm looking for any infestations. I don't notice any. Hair is evenly distributed in color. Texture looks like she showers regularly. So that's good. Now, I'm going to assess all your visible body areas of your skin. Sorry. So pigmentation is consistent throughout. Now can I see one arm? So color is normal for ethnicity. She's warm. She's dry. I'm going to assess skin turgor, which is good. It's almost immediate, which means she's hydrated. I don't notice any edema. Are you in any pain anywhere on your skin? No? Okay. So I don't notice any ecchymiosis. I don't notice any growths or tumors. No inflammatory lesions or infections. Now can I look at your nails? So nails are smooth, they're pigmented, not too thin, not too thick, and they're round. I'm going to assess cap refill. Good. Can I see the other one? Good. Both are less than 3 seconds. Now, can you make a heart shape for me so we can assess clubbing? No signs of clubbing, which is good. So now we're going to move on, and I'm just going to look at your head and your neck. So your head looks erect, your neck looks centered, and everything is symmetrical. So again, I put on gloves again, and I'm just going to palpate your head. And head seems round. I don't feel any bumps, no lesions. Is there any pain here?
No.
And now I'm just going to palpate different spots, and I just want you to tell me if you have any pain. Assess your frontal sinuses.
No.
Maxillary. Now I'm going to assess your lymph nodes. Can you put your hair behind your ears? Feel for your pre-auricular lymph nodes. Pain?
No.
Post-auricular?
No pain.
Submandibular? Cervical? Supraclavicle?
No.
Good. So I think now I'm going to move on to your senses. Oh, actually first I want to assess your trachea. Trachea is midline. And now I'm going to assess your thyroid, and I'm going to come around. Can you swallow for me? Good. Thyroid is hard to palpate, which is normal. Now I'm going to move on to your senses. So I'm going to start with your eyes. So eyes are even. They are oval. I'm going to look at them. Look at your sclera. Scleras are white. Irises are evenly distributed in color. Look at your conjunctiva. Conjunctiva are pink and moist. No sign of discharge. Eyebrows, eyelids, and eyelashes are evenly distributed. Have you had any problems with vision lately?
No.
Now I'm going to move on to your ears. Can you put your hair a little bit behind your ears? So I noticed 3 piercings on both sides. No sign of infection. They are symmetrical to the head. I don't notice any drainage or foreign objects. None in this either. Now I'm going to touch in 2 places on your ears, and I just want to tell me if you have any pain. Here?
No.
Here?
No.
How about on this side?
Mm-hmm.
Here?
No.
Good. Have you had any problems with hearing lately?
No.
And also eyes look good and they're symmetrical. Now I'm going to come around. I'm going to go behind you and whisper 2 words on each side, and I just want you to repeat them out loud. This is just to test your hearing.
Okay. Nurse. School.
Good. So hearing seems normal. So now I'm going to go on to your nose. And so nose is midline, symmetrical to the face. I'm just going to look in your ears. For any foreign objects or drainage. I don't notice any. I'm just going to assess your patency, so can you block one side and breathe in? Good. Now on the other side. There's our patent bilaterally. Have you had any problems with smelling in the past?
No.
Alright, so now I'm going to assess your mouth. So I don't notice any lesions on the lips, no cold sores. Can you smile? Teeth are in good dentition, like she brushes her teeth at least 3 times a day. Now can you open your mouth? I don't notice any odor. The mouth is pink. It's moist. The uvula is midline. The tonsils. Sorry. That's okay. The tonsils are M-shaped. Can you swallow for me? Do you have any pain swallowing?
No.
No. And then usually I'd have a piece of gauze and I'd look at her tongue. Can you stick out your tongue for me? And I'd move it up, down, side to side to look at tongue symmetry, and everything looks good there. You can put your tongue back in your mouth. Have you had any problems with taste in the past?
No.
Okay. So now I'm going to move on to your respiratory assessment. So she doesn't appear to have any labored breathing. Are you having any shortness of breath or anything like that?
No.
Anything to be concerned about? So her chest seems to be cone-shaped, which is normal. Her chest is rising and falling symmetrically bilaterally. Now can you stand up and face that way? I'm just going to assess for chest expansion. Go a little this way, yeah. Can you breathe in? And chest expands 1 inch bilaterally. You can sit back down. And now I'm going to listen to your lung sounds. So here I'm always listening in between the intercostal spaces, never on any bone, so I can hear nice clear lung sounds. So first I'm going to start at the apices. Can you breathe in? Good. Breathe in on this side. And I'm going to feel for intercostal space. Breathe in. Good. Breathe in. How about here? Sorry if I'm doing too much. Breathe in. Now I'm going to assess your right middle lobe. Now can you breathe in? Good. Now can you face the back towards the camera? So now once again I'm feeling around the scapula to make sure that I'm not going over any bone Can you breathe in? Good. How about here? Good. Here. Here. Alright, and last one. This is just to assess the right lower lobe. Breathe in. Good. So all lung sounds are clear bilaterally. I don't notice any wheezing, any rhonchi, any crackles, any stridor. So everything looks clear there. So now I'm going to move on to your cardiac assessment. So there appears to be no problems with circulation. I don't notice any cyanosis. Her cap refill was good. There was no sign of clubbing. Let me see your hands. They're both warm, so that's good. So now I'm just going to palpate the precordium, which is right over your chest wall. I don't feel any masses. I'm not feeling any thrills. And I don't feel any heaves. So now I'm just going to assess your heart sounds. I'm going to listen to the aortic. And the pulmonic. Herb's point. Face a little that way. And then tricuspid. And mitral. And now I'm going to assess with the bell on my stethoscope to assess for any murmurs at the aortic, at the pulmonic, at herbs, and then at tricuspid, and at mitral. So rate and rhythm seem normal. I don't notice any murmurs. So now I'm just going to listen to both carotids. So I don't hear any signs of swishing, no bruise. So now I'm just going to palpate your peripheral pulses, and I'm going to do carotids one at a time. Now can I feel your radial? Now I'm feeling the dorsal pulses. And the posterior tibialis. So peripheral pulses all seem strong. They're about at a grade +2, so that is normal. So now I'm going to move on to your abdominal assessment. Can you lay on the couch for me? And can you lift up your shirt a little bit? So I don't notice any distension, no appearance of ascites, no stretch marks. So now I'm going to listen to bowel sounds, which I should hear about 5 to 30 gurgles per minute. I'm going to start in the right lower quadrant, following the large intestine. Right upper. Left upper. Left lower. So there's presence of bowel sounds in all 4 quadrants. I'm going to listen to your vascular sounds. And first we're going to listen with the aortic. The renal. And the iliac. No sign of bruise there. Everything sounds good. Now I'm just going to palpate. I want you to tell me if you have any pain in any quadrant.
Okay.
Here.
No pain.
Here.
No.
Here.
No.
Here.
No.
No sign of distension either. So your abdomen looks good. Now you can put your shirt down. Can you stand up? Can you face the back wall and act like you're diving into a pool? Now I'm just palpating your spine. I don't notice any deviation, no curvature, nothing like scoliosis. Alright, you can stand up. Now can you face me? And put your hair behind your ears. Now I'm assessing your TMJ. Can you open your mouth as wide as you can? No crepitus there. That's good. So can you put your arms out? Or actually, let me start with your shoulders. Shrug against resistance. Good. Put your arms out. Push down on my hands. Push up. Can you grip my hands? Upper extremities are 5 out of 5 bilaterally. Now I'm going to assess for any crepitus at the joints. I'm going to start at your shoulder, or actually I'm going to start at your neck. Can you go side to side, forward and back? No sign of crepitus. Can you roll your shoulder in a circle? No crepitus there. Other one. And then can you flex your elbow? No sign of crepitus. Good. Can you roll your wrists? Good. Can you wiggle your fingers? No sign of crepitus. Now can you sit back down on the couch for me? So now I'm going to do your lower extremities. Now can you push down on my hands with your legs out? Good. Push up. Now I'm assessing the strength in your feet. Can you, actually you flexing on one side? How about the other? Good. Now can you push down like on a gas pedal? Good. Lower extremities are 5 out of 5 bilaterally. Can you lay on the couch for me? Now I'm assessing the hips. So on the first side, can you bring your leg up and down and out? And have up and down and out. No crepitus there. Now can you flex your knee? Good. Other knee? Good. Can you roll your ankles? And can you wiggle your toes? I don't notice any crepitus in the lower extremities or the upper extremities, so your musculoskeletal system looks good. Your strength is 5 out of 5 bilaterally. Everything seems normal in your assessment. Do you have any other questions or concerns?
No. Okay, thank you.
All right, well, your assessment is over. Thank you.
All right, thank you.